Hello doctors and FMGE aspirants. Myself Dr. Sasi. I cleared my FMGE in Jan 2023 with a score of 238 and I completed my NEET PG with a rank of 1401 in 2024. With my experience and expertise in NB pattern of examination, today I am with you with must know and most important topics for your upcoming FMGE examination. Today I brought you 319 topics from all the 19 subjects. With these important topics, you will be able to get maximum number of questions in your main examination and also in your grand test. If you study these important topics, for sure you will be able to cross this 150 mark. And with my assurance, we'll move on to the topics. First, we'll see the anatomy part. If you see this anatomy part, there will be 15 to 18 number of questions will be asked from the main examination. And when we see this must know topics, first you need to know what it is the embryological derivatives and the arches. If you see these arches, they will ask you mostly the muscles and the cartilaginous derived from these arches. And sometimes they may ask you which of the following is not a derivative of this arch. So most of them, they will revolve around this. Next, if you see this next important point, which is the anencephaly. So mostly this anencephaly and all the neural tube defects, they will give these images and they will ask you to find out which of the following neural tube defect is this. And the third one, it is what? It is the type of epithelium. They will give you this histological image and they will ask you to find which type of epithelium is this. Sometimes they may ask you like from where this epithelium belongs to. And the final one, it is what? It is the type of joints. In general anatomy, they will ask you this type of joints. They will give this normal anatomical image, or sometimes they may give you this x-ray and they will ask which type of joint is this. And next one, it is what? It is the vertebral levels. They will just mark some point in the body and they will ask you at which vertebral level or which vertebral disc level this point belongs to. And next one, it is what? It is the nerve injury. Sometimes they may just give this anatomical image and they will ask you which of the following nerve is related to the structure. Or sometimes they will go clinically. They will give this x-ray of this humerus which is having this fracture at shaft of humerus. Once they give this x-ray of shaft of humerus, they will ask you which of the following nerve is related to it. So we know it is radial nerve. Then they will give what are the tests for the nerves. Sometimes they will ask you about the median nerve. Then they will ask you about the test like the pen test. Then they might be asking you what is the management for these nerve injuries. In orthopedics part, they will ask you about the spleen. So this nerve injury, it is much more important. It is one of the most important topics in anatomy. Fine. Next, about the tendons of forearm. They will give this image of the forearm and they will mark this tendon and they will ask you what tendon is it. Fine. Next one is our favorite anatomical stuff box. In anatomical stuff box, they will ask two things. One is what? One is the boundaries. Second one is the contents of this anatomical stuff box. And sometimes they may ask you in relation to the fracture. They may ask you there is a tenderness and swelling over this anatomical stuff box. Which of the following bone might be fractured? So it is what? It is the scaphoid bone. So they will ask you from the orthopedics perspective. Next one, it is the gluteal region and the lower limb muscles. Mostly they will revolve around this gluteal region for this superior and inferior gluteal nerve. Next, about the skull foramenas. In case of skull foramenas, it is mostly tested from the NEET PG perspective. Whereas in a case of FMGs, they will ask you mostly the structures which are passing through this foramina and sometimes the nerve injuries even. Fine. Next, this is the must do. It is the must do topic, which is what? Which is the CT section or the axial section of this brain. In brain, they will give this axial section and they will ask you to mark which of the following nucleus is this, or they ask you to find out which of the following part of the brain is there. Fine. Next, about the direct stomach blood supply. And next, in the case of muscles of mastication, mostly they will give all the muscles of mastication and you need to rule them out. Fine. Or else sometimes they will give the muscles and you need to find out the nerve supply. And in the case of tongues, you need to find two nerve supply. One is for the general sensation and another for the taste sensation. Okay. This point, which is what? Which is this esophageal constrictions. These esophageal constrictions, they give in two variants. One from the surgical perspective, they will tell you within this esophagus, you are doing endoscopy and you are experiencing this constriction. At which level you may experience this constriction or about which centimeter they will ask. Whereas they can give some images of direct esophagus and they will ask you what is the constriction which causes this impression. Fine. Next, about the openings of the diaphragm. In openings of the diaphragm, mostly they will ask content of the openings of the diaphragm. Okay. Then about the chambers of the heart. So they won't ask you directly what is the chamber of the heart which forms this right side of the heart or left side of the heart. Mostly what they will do, they will give this transverse section of the thorax and they will ask you which of the following is the marked chamber of the heart. Fine. Next, it is same for the thorax and abdomen. Mostly in abdomen, what they will do, they will ask about the organs. The organs of the abdomen, they will just mark. Sometimes they will ask you to match, or sometimes they ask you to identify which of the following organ is this, or sometimes they will ask the supply to the spleen. Fine. This is about the transverse section of the abdomen and the transverse section of the thorax. Next, about the femoral triangle. In femoral triangle, mostly they will ask content of the femoral triangle and about the floor of the femoral triangle. Fine. Next, in a case of larynx, mostly they will ask about the cartilages forming the larynx. Fine. These are the most important topics in the anatomy perspective. With this understanding, we'll move on to the next part, which is the physiology one. From physiology, for FMGE, we get less number of questions because it is being integrated with medicine and pathology. So physiology will get around 5 to 8 questions as a proper physiological question, and out of which most of them it will be from our topics. Fine. You need to find about this intracellular receptors like GPCRs and tyrosine kinase receptors and about this transport mechanism. What are these transport mechanism? Your SGLTs, your clues. So all of these things you will be coming under the physiology. Next, about the action potential, you need to know they will draw this thing. They will draw this action potential and they will ask about this depolarization, plateau phase and the repolarization phase. Which of the following ion is responsible? It is same for the cardiac action potential as well. Next, about the lung volumes and curves. Here they will ask you which of the following lung curve is this, or in which of the following conditions you will be able to appreciate this type of flow volume loops. Fine. And next, the muscle physiology. In muscle physiology, mostly they will give this sarcomeric image and they will ask you which point is this or which line is this. Fine. And next, about this absorption of nutrients in the GIT. So in GIT, we know there is mass absorption of nutrients, but mostly they will focus on iron, folic acid and the vitamin B12. So they will ask the places of its absorption. Next, about the movements. About these movements, they will ask which of the following is the pacemaker cell, or they will give you this image of these movements and they will ask you which of the following movement is this, which of the following chemical is causing constriction in a case of peristalsis or relaxation in a case of peristalsis. So remember all these things. And the GIT hormones, mostly it will be what? It will be related to the emptying of the stomach and the gallbladder contraction. So two hormones or few hormones will be responsible for this gastric emptying. So you need to learn about this gastric emptying hormone. And next, about the part of nephrons. We know there are different parts of nephron. In nephrons, what they will ask, which of the following part of nephron there is the maximum absorption of water? It is what? It is the PCT. So mostly they will ask this question, or else they can ask which of the following part is having the maximum ionic absorption. Fine. And the same thing can be modified in the pharmacological perspective also. Fine. Next, about this RAS mechanism, they will give you this diagram of this RAS mechanism and they will point you to some chemicals, either renin or ACE enzyme. So they will point and they will ask you which of the following is this. So they will mark it as X and they will ask you which of the following is that. Fine. And next is about the nucleus of the thalamus and the hypothalamus nucleus. Mostly they will give this function of this nucleus and they will ask you what is the name of the nucleus which causing this function. Fine. And in cardiac cycle, you need to learn about the heart sound. Mostly they will revolve around this isovolumetric contraction and isovolumetric relaxation. So if you study these important topics from the physiology, mostly we'll be able to get the maximum questions of topic. Fine. With this understanding, we'll move on to our next subject. The most important questions or most important topics from the biochemistry is what it is the vitamins. So if you see these vitamins, there will be at least 3 to 5 questions from this vitamin. So in biochemistry, there will be 13 to 15 questions will be asked in your FMGE examination. And most of the questions will be from these must-know topics. So the first one, it is what? It is the vitamins. They will ask you what is the source of this vitamin and what are the clinical features we'll be having if we are having the deficiency of these vitamins. And to treat this condition, which of the following you will give. And sometimes they may ask you which of the following enzyme will be used for the diagnosis of this vitamin deficiency. For example, RBC transcutaneous. This enzyme is used for diagnosing which of the following vitamin deficiency. Fine. Next one. This rate limiting enzymes in carbohydrate metabolism, they play a crucial role in your examinations. Mostly they will ask about this glycolysis, about TCA cycle and gluconeogenesis. Fine. Next, these disorders: glycogen storage, mucopolysaccharidosis, lysosomal storage disorders. All of these disorders, they will ask in two methods. One, they will give you this clinical features and they will ask you which of the enzyme is responsible for this clinical feature. Or sometimes they will give this clinical features, they will ask you the disease directly. Fine. Next, about this ETC, they will ask about the incubators. Which of the following is the incubator of this complex 1, complex 2, complex 3 and complex 4? So remember, don't forget to study this for your main examination. And next, most important one, it is what? It is the amino acids. In amino acids, they also ask in different types. One of them is what? They will ask in the classification of amino acids. So classification of amino acids, then how they will ask? They will ask about this amino acid metabolism. They will ask about this amino acid metabolism disorder, for example, phenylketonuria, tyrosinemias. And they also may ask about one more thing. It is what? It is the amino acid derivatives. It is what? It is the amino acid derivatives. Okay. Next, about the enzymes. If you see about this enzyme part, mostly they will revolve around this competitive and non-competitive inhibitors. They will give this graph and they will ask you which of the following is this graph represents. Either it might be of competitive and non-competitive. So just remember. Next, about this apolipoproteins and its mechanism and its receptors. Mostly this apolipoproteins, what it does, it will help in the transfer of lipids from our gut to the liver and liver to the entire tissues. So they will give this receptors and they will ask for its mechanism. And in some cases, they might ask this hypolipoproteinemia classifications. Fine. They will give the symptoms and they will ask which type of hyperlipoproteinemia is this. Fine. Next one, about this purine and pyrimidine composition. This purine and pyrimidine composition, they will ask which of the following making this carbon and this nitrogen. Fine. And about the types of RNA and template and non-template strands. They will give this template strand and they will make you to find this non-template strand or the RNA coding strand. Okay. Or sometimes they might give some calculation type of questions also. So these are the most important topics from the biochemistry perspective. We'll move on to our next subject, which is what? Which is the pathology. Pathology, it is the combination of our physiology and medicine, and in between the pathology comes. Fine. Here there will be a questions of almost from 13 to 18 questions. So roughly around 15 questions, there will be a typical pathological questions will be there. Fine. And about this first one, which is what? Which is the microscopic changes in the reversible and irreversible cell death. So what they will do? They will give these changes in the reversible cell death and irreversible cell death. They will ask in which of the following cell death is in reversible or the irreversible one. Fine. Next one, it is what? It is the genes for this apoptosis and genes responsible for this anti-apoptotic genes. Fine. Next, this genes for aging, which is what? Which is the sirtuins. They ask about the sirtuins and they will ask what are the methods to prevent the aging. Fine. And about this inflammatory mediators, mostly they will give this direct point and they will ask which of the following is being controlled by this inflammatory mediator. Fine. And sometimes they may give this slides of these giant cells. Once they give this slides of the giant cells, they will ask which giant cell is this, or sometimes they may correlate with some diseases. For example, recently they asked about the Langhans cells. So they will give this image of this Langhans cells and they will ask you which of the following disease is related to this giant cells. Fine. And next important topic, it is what? It is the genes for this carcinogenesis. In carcinogenesis, they will give this history of this carcinoma or tumor and they will ask you which of the following gene is responsible for this. Fine. And about this tumor markers, mostly the same they will do. Either they will give this histopathological imaging or they will describe you in history. And from there, they will ask which of the following tumor marker you will use to identify this condition. Fine. And recently, they are focusing mainly on the pedigree chart. Previously, they used to ask about, they are giving few conditions and they will ask you which of the following is it autosomal dominant or autosomal recessive. Whereas now, They started giving this pedigree chart of autosomal dominant, autosomal recessive, even X-linked disorders, and currently mitochondrial disorders. They give this pedigree chart and they will ask you which of the following kind of inheritance is this. Fine. Next important topic, it is what? It is this. This is the diagnostic techniques for these genetic syndromes. We know for these genetic syndromes, we use different methods. One is what? One is this karyotyping. Okay. Next one is what? FISH and the comparative genomic hybridization. So all of the methods they will just give and they will ask which of the following method is this, or sometimes they give this karyotypic picture and they will ask which of the following syndrome is associated with this karyotypic imaging. Fine. Next one, it is what? It is the amyloidosis. In amyloidosis, mostly they will ask you about this diagnostic part and the types of amyloidosis. Okay. There will be what? There will be the staining methods and the types of amyloidosis. So these are the few important points from the pathology part. Then we'll move on to some more important topics in pathology. One is what? One is the SLE. From the SLE perspective, mostly they will ask what? They will ask about the antibodies responsible for SLE. Okay. And this associated antibodies and its clinical features, especially the clinical features, they are being repeatedly tested. And in pathology, one more thing, it is what? It is the lupus nephritis. So they are testing more on lupus nephritis even. Fine. Next, about this hypersensitivity reaction. About this hypersensitivity reaction, mostly what they will give this description of a hypersensitivity reaction. Fine. And they will ask you which type of hypersensitivity reaction is this. Fine. And about this rheumatic heart disease and endocarditis, mostly they will ask you for the criteria for diagnosis and their histopathological features. Fine. And the next most important one, it is what? It is vasculitis. And vasculitis can be correlated with both pathology and medicine. And this vasculitis, you need to study for must. It is the giant cell arteritis, Takayasu arteritis, HSP and Kawasaki disease. Mostly you need to know about this diagnostic part. Fine. And about this asbestosis and sarcoidosis, you also need to know about the diagnostic part. How will you diagnose these conditions? Fine. And about this lung tumors, you need to know this IHC mark. About this IHC markers, how will you able to differentiate this IHC markers of squamous cell carcinoma and about the adenocarcinoma of the lungs. Fine. And about Barrett's esophagus, they will ask you about the metaplasia and about the staining also. Fine. And the next GIT most important one, it is what? It is the celiac disease. They will give this histopathological image of the celiac disease and they will ask which of the following disease is that, or which of the following HLA is being associated with this disease. They will ask like that. And it's about the histopathology image of the Whipple's disease also. And GIST, they will ask you the gene which is responsible for the GIST. Fine. And in urinary system, mostly they will ask about the urinary stone crystals. So the microscopic appearance and about the types of RCC in the histopathological imaging. In the histopathological imaging, they will ask which type of RCC is this. Okay. And in CNS, mostly they give two things. They can give this gross specimen, for example, gross specimen of this glioblastoma multiforme, or else they can give you this HPE examination of this schwannoma, meningioma and the oligodendroglioma. Fine. And without this question, the paper will be always incomplete. So it is what? It is the anemia and its type. So mostly from this anemia and types, mostly they will try to correlate between these two anemias and they will ask you which type of anemia is this. Fine. And about this next part, it is what? It is the leukemia. In leukemia, mostly what they will do, they will give two things. Either they will give this peripheral smear and ask you to identify which type of leukemia is this, or sometimes they can give you this bone marrow aspiration or bone marrow biopsy and they may ask you which type of leukemia or lymphoma is this. Fine. And about this CD markers, you should be remembering for this leukemia also. Fine. And about lymphomas, mostly what they will give, it is what? It is the translocations. They give this translocation and they will ask you which type of lymphoma is this, or sometimes they will give this proper histopathological image. For example, this statistic appearance in the case of Burkitt's lymphoma. Likewise, they will give this histopathological image and they can ask you. Fine. These are the most important topics from the pathology perspective. With this understanding, we'll move on to our next subject. Next, it is what? It is the pharmacology. These pharmacology topics, they are mostly integrated with medicine. So remember one thing, this pharmacology, there will be 15 to 18 questions in your main examination. If you read this must know topics, for sure you will get this 13 out of this 15 to 18 topics for sure. Fine, so don't miss it out. And the first important topic, it is what it is, the phases of clinical trials. In this phases of clinical trials, what you need to know is that whether we are choosing them as healthy people or the patients. So healthy people or patients. Next one, it is that what we are doing, what we are measuring. We are measuring this maximum tolerable dose, efficacy or efficacy testing. So you should remember all of these things in phases of clinical trial. The next important point, it is what it is, the graph of efficacy and potency. So they will draw this graph of efficacy and potency, and they will ask you which of the following drug A, drug B, drug C, which of the following is the most efficient or most potent in nature. Fine. And recently they started asking about this formulas even. And few drugs in our general pharmacology you need to know which are what? They are the enzyme inducers and enzyme incubators. Fine. And about the ANS system, you need to know few drugs for sure. They are what? They are this physostigmine and pyrostigmine. Physostigmine and pyrostigmine, their uses, and this OPC poisoning and carbamate poisoning and their uses. Like in a case of OPC poisoning and carbamate poisoning, which of the following drug you will use for the treatment? Atropine and pralidoxin. And if there is any toxicity of this atropine, how will you manage? So it is the same, like OPC carbamate poisoning and atropine uses and its toxicity. And here also you need to know about this anti-Parkinson and anti-Alzheimer drugs or Alzheimer's drugs which is used. Next you need to know about this sympathetic drugs and its receptors like adrenaline, noradrenaline, dopamine and dobutamine. So all of these drugs have in which receptor they act. And you should know about this beta 2 agonists. So read about this SABA and LABA. Okay. Next we'll move on to some more important topics in the pharmacology. If you see some more topics, it is what? It is the heparin and warfarin. Like mostly this heparin and warfarin, they will be asked about their side effects and their usage in pregnancy. Like when you will use heparin and when you will use warfarin. Fine. And now they started asking about the newer generation of anticoagulants even. So remember to study this newer generation of anticoagulants and just see the side effects of heparin and warfarin. Fine. And about this antihypertensives, you need to just study like antihypertensive management in specific cases. Okay. In different clinical scenarios, how will you manage or how will you provide this antihypertensive treatment? Fine. And ACERB, mostly they will ask about their side effects. Mostly they will ask about what? They will ask about their side effects. And which of the following drugs they are used in congestive heart failure? It is the most important topic in both pharmacology and medicine perspective as well. Fine. And about the statins, they will ask about their mechanism of action, uses and the new drugs for this hyperlipidemia. Fine. And for peptic ulcer, they will ask about this drug regimes. Mostly they will revolve around this drug regimes and the side effects of PPA. Fine. And in JIT, now they started asking about the drugs affecting the motility. And the next one, it is what? It is the side effects of the drugs which is used for the constipation. Okay, it is the side effects of the drug which we use for constipation. Fine. And the next important topic, it is what? It is the osteoporosis. You need to know everything about osteoporosis because there will be three perspectives. In gynecology also you will study, in pharmacology also you will study, and in ortho also you will study. So remember, so you need to know about all the drugs, oral and IV drugs of osteoporosis. Fine. And next one, it is what? It is the generations of antihistaminics. Like what is the difference between the generation 1 and the next generation of antihistaminics? Fine. Next, about the CNS, you need to know about the anti-epilepsy drugs, mostly about the phenytoin and valproate. They will ask you the side effects of this both drugs. Okay, so remember about this usage and its side effects. Fine. And this drugs usage in gout in both acute and chronic gout. They will ask about the drugs which are being used in acute and chronic gout. Fine. So these are the drugs which are used for this acute and chronic gout. Now we'll see few more drugs. You need to remember about this antimicrobials, just this mechanism of action. Don't deep dive and don't memorize much things into it. Just remember the mechanism of action. It is more than enough. Fine. In the case of antimicrobials. Whereas in the case of anti-neoplastic drugs, you need to know this mechanism of action and also the side effects. So two things you will remember for anti-neoplastic drugs. They are what? They are the mechanism of action and the side effects also. Fine. And antidotes you should know must, and drug of choice of all the conditions, it is an optional one. You will be able to remember all the drug of choice, it's well and go. If not, just remember the important ones. Fine. So with this understanding, we got to know like which are the important topics from the pharmacology point. Okay. With this, we'll move on to our next subject. Fine. It is what? Can you guess which is the next subject? It is what? It is the microbiology. Fine. In this microbiology, we'll see the most important topics. If you see the first one, from the general part, you will be able to understand just these methods of disinfection and sterilization. Okay. About this disinfection and sterilization, they commonly ask questions from it. Fine. And they also ask questions about the controls which are being used in this case of disinfection and sterilization. Okay. And next one, it is what? It is the transfer of bacterial decision. Like about this conjugation, they will ask the question. Fine. And next, third important one, it is what? It is the bacterial growth curve. They will ask questions about this bacterial growth curve. Okay. And about the culture media, just remember, sometimes they will just ask directly about this culture media, or sometimes what they will do, they will just give a clinical scenario of some infection and they will ask you which of the following culture media is being used in this condition. Fine. And about this super antigen and heterophilic antigen, sometime or other they are asking the questions. Fine. And about this mechanism of action of bacterial toxins, it is one of the very important topics from the microbiology perspective. There are only few toxins, so just remember this few bacterial toxins. Fine. And you should know how we'll be able to differentiate between this staphylococcus and streptococcus. It is the most basic things and they will always test on the most basic things. Just remember. Fine. And few more about the microbiology part. In microbiology, you need to know about a few important bacteria. In this bacteria, you need to know about their structure, their components and their culture characteristics also. Fine. These bacteria include Bacillus anthrax, Listeria, gram-negative bacteria like Neisseria gonorrhea and meningitis, and influenza, typhoid, Clostridium perfringens and difficile, and the Corynebacterium diphtheriae. Okay. And the final one, it is what? It is the tetanus. So you should know in and out about this bacteria. Fine. And about this rickettsial infection, you need to know about this positive agent and also about the vectors which are being used. Fine. Then moving ahead with more important topics of microbiology, you will be able to see this mycology. Mycology is the very important topic of this microbiology. If you see this mycology, it will yield you the maximum marks. Okay. It includes this subcutaneous mycosis, dimorphic fungus, tinea and candida. So these are the most important topics from this mycology part. Then about this viruses, you need to know basic things about the viruses, the shapes and whether they are DNA or RNA viruses. Fine. And about these viruses, you should also know about the inclusion bodies. There might be this intracellular or intranuclear inclusions. So you need to know about these inclusions also. And the next most important topic, it is what? It is these three diseases: chickenpox, HSV and CMV. If you can, then remember also EBV. So if you read all these conditions, there will be each question from each one of these topics. Fine. And about parasitology, you need to know about this eggs and larvae. So how they looks and which of the following is the exception. So you need to, if you remember all this thing, you will be able to grasp maximum correct from this microbiology. Fine. And the final one, it is what? It is the malaria peripheral smear. So you need to know this, how this different species of malaria looks like. The multiple rings in a case of falciparum, whereas others will show the single rings. Okay, fine. And the banana shaped malaria parasite. So just remember about the peripheral appearance of the malaria. Okay. And these are the must know and most important topics from the microbiology perspective. So these are the most preclinical subjects you should be clear of, and this preclinical's weightage will give you a big push in your first part of your examination. And going ahead, the easiest and most high yielding subject. We know there are how many major subjects? There are 4 major subjects. They are what? They are the PSM, OBG, medicine and surgery. Out of which PSM and OBG, they are the easy scoring subjects. So remember to get the maximum marks from these subjects. So PSM will get around 30 to 40 questions. So it's depend on the mood of the examiner. If he is very good, he will take 40 questions from the PSM. Okay, remember, from 40 questions from a single subject, which is this PSM. Okay, in PSM, you will start with this epidemiological study designs. They will ask which of the following study design is used in this, or which of the following study design is used to calculate the incidence. So remember to study about this study design. Fine. And about this level of prevention, they will ask you which of the following is the secondary level of prevention. Like this, they will give 4 options. Fine. And about this demographic cycle, I don't know what, the examiners become crazy nowadays. They're asking about this demographic cycle in each and every examination. So if you forget this demographic cycle, you are out of this examination. So try to read this demographic cycle for sure. Fine. Next, about this parameters like HDI, PQLI and the Kupasamy scale. Fine. And next one, it is what? Next one about this formulas of this rate. If you're able to read these formulas, you will be able to apply in the exam. If you're able to apply in the exam, you will be able to get the marks from it. Fine. And recently they also started asking about this instruments which are being used to measure this quality of air. And remember, study also the instruments in PSM, like the Anganwadi worker which we use, like Shakey's tape, Salter scale. So remember about all these things. Fine. And you also should know about this RD of vitamins, iodines, iron, folic acid and their calorie. So at least this should be remembered for this pregnant and lactating females. Previously they are asking about this normal individuals. Repeat. Previously they were asking about this normal individuals. Now they started asking about the pregnant females and the lactating females. Fine. And this is a must do topics. It is what it is, the food adulterants and toxins. They will give you this classical history and they will ask you which of the following toxin is responsible for this condition, or else which of the following is used as an adulterant which may lead to this condition. Okay, so just read for sure this food adulterants and its toxins. Fine. Next, this vectors, they randomly ask. Mostly they will ask from this mosquitoes, sometimes this flea and louse and ticks even. Fine. And this about the primary health, they ask about the pillars and its referral system also. Fine. And in international health, you need to know about this logos, headquarters and just few campaigns like Gobi, FFF and few more institutions like SIDA and DANIDA. Fine. And about the vaccines, in vaccine part, you need to know these things for sure, because there will be one sure short question of vaccines in your examination. So in vaccines, what is the questions you will see? It is what it is the first, the type of vaccines. They will ask you which of the following is not a live vaccine. Fine. There you need to identify. Next, they will ask you which of the following vaccine will not follow this open vial policy. Fine. And they also will ask about this lapsed immunization. A baby is bought with 13 months of age. Which of the following vaccine you will give? Fine. And about the side effects of the vaccination. Okay. All of these things, they are being repeatedly tested. Fine. And about this health communication methods, they will give this image about this ORS preparation or about this symposium or about panel discussion. They will ask you which of the following health communication method is this. Fine. And about this RTI and STI kits. Okay. They will give you this clinical feature of this ulcer and they will ask you which of the following kit you will use or color of the kit you will use. Fine. And this too, they are this bread and butter of the PSM. Okay. They will ask about this triage and this biomedical waste management. So there will be one definite question from this biomedical waste management. So don't make wrong in this simple thing. Fine. And in biostatics, they started asking about the graphs in the biostatistics and they ask about this calculation of standard deviation from the mean. Fine. And now from the national programs, they started asking about this logos and especially of national TB and NACO and NLEP, JSSK and RBSK. So all of this logo they will ask and they will ask what is their goal and what is their aim. Okay. And you should also study about the drugs which are being used in TB, leprosy, HIV and malaria. What are the regimens you will use? If there is any resistance, which of the following drugs you will skip and which of the following drug you will use. So remember all these things from the PSM part. And about the most important worker, who is what? Who is this ASHA worker? So you should always remember about this ASHA worker, Anganwadi worker and the multi-purpose worker. So you need to know what is the eligibility to become this ASHA worker and what is their role in the community. So these things you should be in your finger, remember. And about this anemia Mukt Bharat, they fall in love with this anemia. So we studied in pathology, in medicine there will be anemia. So here also they will ask about this anemia Mukt Bharat. They will ask about this dosage for the various age group, and they will ask you what is the color coding for this age group. Fine. And these two immunizations, it is the must do part. So these two immunizations, they are what? They are this rabies vaccination and tetanus immunization. So these two immunization you should know for sure. Okay. And these are the very must and most important topics from the PSM perspective. If you know these topics, you will be able to get this maximum questions correct in PSM part. Fine. With this understanding, we'll move on to our next subject. What is the next subject? Can you take a guess? I hope so you guessed it correct. It is what? It is the FMT. So it is a bridging subject. If you ask me if FMT is a tough subject, I will tell it is the most easiest part. Like there will be 10 questions. The minimum number of questions being asked, it is what? It is 10 questions. Freaking 10 questions will be asked from this FMT part. And if you just read this few topics, you see just this few topics, you will be able to get this all these 10 questions correct. So it is what? It is the most valuable subject in your curriculum. So first one, you know about this medical negligence. Like now recently they stopped asking about the loss, like about this numberings. Fine. So if you still want to remember about this numberings, then you remember about the rape, dowry death, vitriolage and the abortions. So just remember for these few conditions and about this special cases of medical negligence. Fine. And just remember about this hierarchy of courts and their fines. And as I told, there's this punishment for this rape and this dowry death. Dowry death. Also what? Also this abortion. Okay. So just remember for these conditions only. Okay. Next, we'll move on to this thanatology. In thanatology, you should know about this hanging and asphyxial death. Like what are the types of hanging and what are the types of asphyxial death. They will give this image and they will ask you which of the following is this cause of this asphyxial deaths. Fine. And next you need to know about this post-mortem changes. They will show this image of this cadaveric spasm. Okay. And sometimes they give this image of this rigor mortis and they will ask you which of the following rule is used in this condition. And in livor mortis, they will tell you at which time this fixation occurs, or sometimes they will ask you which of the following poisoning may lead to this kind of discoloration. Fine. And about this changes of marbling even. Fine. And the patient is died. We did examination. Now you need to identify who is he. So you need to know about this fingerprint types and sex identification from the skeleton. So what is the methods you will use to identify the skeleton, or what are the changes you will see from female to a male skeleton. Fine. And you also learn about this type of incision and the autopsy techniques. So remember to learn about this types of incision which most commonly use and about the techniques of autopsy like Litule's technique. Fine. And in injuries, you just learn about this type of wounds, abrasion, laceration. And in bullet wounds, you just learn how a entry wound of bullet look like or how the exit wound of a bullet looks like. Fine. If you're able to differentiate between these two wounds, it is more than enough. Sometimes they may ask you about the range of the weapon, but it is being rarely tested. Fine. Next, about this gun parameters, then about the types of bullets. Okay. This can be asked, but they will ask very less likely. Fine. And this about this blast waves and injuries, it is having this high prevalence of to be asked in your main examination. Fine. Next, this identification methods of your blood and semen. This is what this Barberio's test, Takayama test and Teekman test. So all of the tests, just see the images also, see their description also. It is having this high importance in the forensic method. Fine. And about this toxicology part, just don't forget to study this plant toxicology, and in animal study about this snakes. Okay, snakes and metals, just try to study about this arsenic, thallium, lead and mercury. Fine. And next about this intoxicants like alcohol, cocaine and opioids. Just study the features of intoxication and also study about their withdrawal symptoms. So if you do study these two things, it is more than enough. Fine. And the final most important part of this forensic medicine, it is what it is, the sexual paraphilias. Mostly what they will give this description of the sexual paraphilia, and they will ask which of the following is being described there. Okay, they will ask you the definition of it. Fine. So just remember about this sexual paraphilias. So these are the must know and most important topics from our basics to our connecting subject, which is the FMT. And before taking to the next part, will you be able to identify him? Who is he? Yeah, our favorite Tala. Who is what? MS Dhoni. He told, a calm mind is the ultimate weapon against your battles. So remember one thing, you'll be having lot of hurdles while doing this examination. I know it will be a bit harder in initial days, but later on just remind one thing, once you pass the examination, everything will be falling into your hands. So have a calm mindset in your examination. If you have this calm mindset, you will be able to crack this examination and come out with flying colors. Fine. With this, we'll move on to our next part. Mostly it is what it is, the clinical part. In clinical part, if you score huge in clinical part, no one can fail you. Okay, even NB cannot fail you. Fine. And one of this must know subject, it is what it is, the ENT. ENT, ophthalmology, they go side by side. So each of them, they carries around 15 marks. Freaking 15 marks from ENT and 15 marks from ophthalmology. And there are less topics, small subject and high yielding one. Fine. If you see the first topic, it is what it is, the malignant otitis externa. They will give this classical description of a diabetic person, and they will ask you which of the following is the diagnosis. They will give sometimes the gross image even. Fine. And next one, it is what it is, the otosclerosis. They will describe perfectly in the history, and they will ask you which of the following is the diagnosis and which of the following management you will do for this condition. Okay. And next few air conditions, it is what it is, the serous otitis media, CSOM, and its complication, which is the cholesteatoma. Mostly they will ask you from the diagnostic part, like they will give this clinical feature, they will ask you which of the following condition is responsible for this clinical features. Fine. Next one, they will give this symptoms of pulsatile tinnitus, and they will show this otoscopic findings. They will ask you which of the following tumor is this. It is what it is, the glomus jugulare. And next one, it is the BPPV diagnosis and management part. And the final about the ear, it is the inner ear, the most important topic. It is what it is, the Meniere's disease. And about the ear, they will sometime ask you about this tympanographic findings and also this PTA changes. This PTA changes in conductive hearing loss, otosclerosis, noise induced hearing loss, and even sensory neural hearing loss. Okay. And in facial nerve, it is the most important nerve of our cranial nerves, and they will ask you about this proper normal anatomy and also injury at different sites. Fine. And in ear implants, they will ask you about this images of Baha, cochlear implant, and auditory brainstem implant even. Fine. And next part, which is the nasal part. In nasal part, they mostly ask about the nasal trauma. In nasal trauma, mostly what they will do, they will ask about the fracture part and the hematoma part management. So management of the nasal fracture and its hematoma. Fine. And about the next part, which is the PNS, the paranasal sinuses, they will ask you which of the following X-ray view will be used to diagnose this paranasal sinuses, like Waters view. They will give this view, and they will ask you which of the following view is this. Fine. And next one, it is what it is, the traumatic phase of rhinorrhea. In this case, they will give you this Leifurt's fracture, and they will ask you which of the following modalities you will use for this diagnosis. Fine. And next one, it is what it is, the epistaxis. They will ask you which of the artery is responsible, and they also ask you about the management of this epistaxis. Fine. And the next one, it is what it is, the atrophic rhinitis. In atrophic rhinitis, they will give this classical history along with this image of wide roomy nasal cavity along with this crust formation, and they will ask you which is the diagnosis. Fine. And next, the nasal polyps, you need to differentiate between this antrocoinal polyp and the ethmoidal polyp. Fine. And the next famous disease and the must know disease, it is what it is, the juvenile nasopharyngeal angiofibroma. And mostly they will ask this question for sure in most of the examination. And next one, it is the quinsy and parapharyngeal abscess. They will try to differentiate between this quinsy, Quincke's disease, and parapharyngeal abscess. Okay. And the final part of ENT, they will ask you about this adenoids, like how they look, and what is the complications like serous otitis media, and how will you manage. And if the management part also includes about the hemorrhagic control. Fine, just remember. Next, about this nasopharyngeal carcinoma, they will ask you where does this nasopharyngeal carcinoma originates, and they also ask you like what are the complications it may happen and what is the etiology for this nasopharyngeal carcinoma. Fine. In the case of laryngomalacia, they will give this omega shaped epiglottis, and they will ask you which of the following symptom can be presented in this child. Fine. Or else they will give this typical history along with this image. They will ask you what is the diagnosis in this case. Fine. And next, about this epiglottitis and tracheobronchitis, they will give this typical history along with this image of this thumb in a case of epiglottitis, or else this steeple sign in a case of tracheobronchitis. Fine. And about this JEP-L, about the next one, which is the juvenile laryngeal papillomatosis, they will give this typical image and they will ask you which of the following condition is this. And about this nodules and polyp, they do the same along with this history of this teacher or the housewife. They will give this typical history and they will ask you what is the diagnosis. Fine. And finally, this part. This is the most important part of the ENT. Now recently they are asking about this part. It is what they will give this rehabilitation instruments like electrolarynx, this esophageal voice devices, and they will ask you which of the following device is this. Fine. Just remember, these are the most known and most important topics from the ENT part. Fine. Now we'll start with the ophthalmology. We know ophthalmology, how much questions will come? Yeah, there will be around 15 questions from the ophthalmology also. So if you see this 15 questions, it's really huge, right? So mostly this ophthalmology and ENT, they either put up in first part or second part, or sometimes they will mix and come. Okay, and this 15 marks from ophthalmo and 15 marks from ENT, they will boost your numbers to a very high level. Fine. Once you move on to the important points, the most important topics, the most important topic from the ophthalmology, it is what? It is the cataract. So what we'll study? We'll see about the types of cataract, and we need to know about this surgical steps in cataract surgery and about this complications after cataract surgery like cystoid macular edema, secondary cataract. So these are the things which are being tested about the cataract. And next, about the types of uveitis and the management of these types of uveitis and the methods of IOP measurement, or how will you measure this intraocular pressure. And then you need to know about the types of glaucoma. What are the types of glaucoma? Angle closure glaucoma and the open angle glaucoma. And what you know more? You need to know about this open angle glaucoma, the drugs which we use and its side effects. So glaucoma drugs and their side effects. So these are the things you must know in ophthalmology part. So each one will be carrying at least 1 mark. So sometimes they will ask 2 questions from the each part also. Fine. And you should know how to differentiate from pterygium and pinkisola by an image. Fine. And about this VKC and fictinular conjunctivitis, you should know their clinical features. They will give this typical classical clinical features in a question and they will ask you what is the diagnosis. Fine. And about this trachoma, they also give you this classical features along with this image and you need to diagnose it. Fine. And about the next disease, it is what? It is the keratoconus. In keratoconus also, they will rely mostly on the diagnosis part and the management part. Fine. Diagnosis based on its sign and the management like ring placement and the C3R. Fine. And about this corneal ulcer, we'll discuss, or we need to know about the types of corneal ulcer like bacterial, viral or the acanthomoebic. Fine. And about this staining of conjunctiva, because we know there is a high prevalence of this dry eyes. So we need to know this staining of conjunctiva, and we need to know also the staining of conjunctiva in a case of trauma. Okay. And next, the one of the important one, it is what? It is the retinoblastoma. In retinoblastoma, you need to know about the gene and also about the histopathological examination and also the management for this retinoblastoma. Fine. And the next important one, which is being evolving and recently being tested much more times, it is what? It is the diabetic retinopathy stages. And what are the stages and how will you manage? Fine. And the images of CRAO, CRVO and CMV retinitis. So they will give you this image like a cherry red spot, tomato flash. They will ask you which of the following disease is this fundus image represent. Fine. And about this visual field defects, they will give this point and they will ask you which of the following visual field defect is this. Fine. And about this extraocular muscles, you need to know about their nerve supply, and on paralysis, how they present with. Fine. And about this simple myopia, hypermetropia and astigmatism, what are the lenses or the types of lenses we'll use. Fine. And about the chalazion, you need to know about the instruments which we use for the chalazion management. Fine. And about this ocular trauma, you need to know about this blood fracture, rosette cataract and the iridodialysis. Fine. And final one, it is the lasers of ophthalmology. Means it is being less commonly tested nowadays, but previously they used to test about this lasers of ophthalmology. Fine. Whereas the rest part, they are the most important part. If you are able to get this, all this must know important topics correct, then you will get this 15 marks for sure. Fine. Next, we'll see about this baby subject, which is the pediatrics. It looks small and it is a baby subject, but it holds more than 18 marks. So there will be usual number varies from 15 to 18 questions will be asked from this small pediatric segment. Okay. From where they will ask? They will ask about the neonatal resuscitation, and after neonatal resuscitation, what they will ask? They will ask about this transient neonatal conditions and about the neonatal jaundice and its management. And in respiratory, they will ask you about this respiratory distress syndrome and also the congenital diaphragmatic hernia. Fine. And bronchiolitis and pneumonia, how will you able to differentiate and what is the management of these two conditions even. Fine. And they will ask about this Apgar score. They will ask you to calculate this Apgar score for them, and they also will show this X-ray, and they will ask you like which of the following appearance in scene or which of the following disease will show this typical appearance like egg on string or this cottage loaf appearance or the figure of 8 appearances. Fine. You just remember. Then there's two valuable things. IMNCA guidelines for this pneumonia and dehydration. They will for sure, there will be one question from either pneumonia or this dehydration in each part of examination. Fine. And the final one, it is what? It is the development of the milestones. They will ask you questions from the different developmental milestones. So remember about this developmental milestones, there will be minimum one question, maximum it may range up to 3 questions from this just developmental milestone. Okay. Next, you need to know about these syndromes from the pediatrics perspective, like Down syndrome, Patau syndrome, Edward, Klinefelter, Credit. You need to know their clinical features, how they present with, and their pathology for this syndromes. Fine. And about this febrile seizures, they are testing very frequently. They are asking about this risk factor for the recurrence, about the recurrence, and if there is any febrile seizure, how you will manage them. Fine. And next one, it is what? It is the types of epileptic seizures. What are the types of epileptic seizures and how will you manage them? Okay. And sometimes they may ask you the EEG findings even. So remember about the types of epileptic seizures in children and their management. Fine. And this point, it is getting popular nowadays. It is what? It is the short stature. This is what? This is the proportionate and disproportionate short stature. Fine. Just remember. Next, about this SAM, they ask you the definitions of this SAM. Fine. And they try to differentiate between this marasmus and kwashiorkor. They will ask you which of the following baby is this and which of the following condition you will be able to see this flag sign. Okay. Next one, from renal perspective, they will give this classical history for this minimal change disease, and also they will give this classical history for this PSG. Fine. And the final one, it is what? It is the management of diarrhea in children. In children, how will you manage the diarrhea? So there might be dehydration part also. This diarrhea, they will ask you the separately, might be for the maintenance fluid even. Fine. With this understanding, we completed the pediatrics part. We'll move on to the OG part, which is really OG. Why it is really OG? Because obstetrics and gynecology, it looks very small. It looks also very small, but it yields maximum questions from 30 to 35 questions. So you can easily get these 30 to 35 questions correct if you just take these subjects and grasp this small concept. Fine. So we'll see the most important topics. From gynecology, you need to know about this Bartholin cyst management. Okay. Bartholin cyst and Bartholin abscess, how will you manage? And about this imperforate hymen, they will give you this classical history along with this cyclical abdominal pain. Okay. Bulging out hymen. So they will give this classical findings and they will ask you what is the diagnosis and how will you manage them. Fine. And about this primary amenorrhea, there will be one short question from this MRKH, AS or this syndromes like Turner syndrome or Swyer syndrome. Fine. They also ask about this ambiguous genitalia, Then this semen analysis, they rarely ask, but there is a high chances they are being asked in future examination. Fine. And you should know about this bacterial vaginosis and how will you differentiate from this trichomoniasis and candidiasis. Fine. And in adenomyosis, mostly what they will ask how will you diagnose this adenomyosis. They won't ask in management part, they will ask you about the diagnosis part. So you should focus on the diagnosis of this adenomyosis. Fine. And in fibroid, you know, mostly they will give this term fibroid in their question. Here they will ask what is the type of fibroid they will ask, or else they will ask you the management of this fibroid. So in fibroid, you should learn about the management. Fine. Next, about the endometriosis also, it's the same. Like in endometriosis, you should focus on the diagnosis and the management part. Okay. So you should not look mainly onto the etiology part. You should mainly focus on the diagnosis and management of this endometriosis. Fine. And about this PCOS and OHSS, you should be having this differential diagnosis and the management part also. Fine. And about the genital TB, what are the accidental findings in HSG and how will you manage them? How will you manage their infertility? Fine. And urogynecology, you need to know about this fistula and stress urinary incontinence. They will ask you mainly about the diagnosis part and their management in different ages. Fine. And finally about this cervical cancer. In cervical cancer, mostly they give this classical history. They will ask you to stage them. Once you stage them, they will ask you to provide management for the same. Okay, these two things they will ask. Okay, staging and management part. Whereas in ovarian cancer, you should know how to differentiate from one ovarian cancer to the other ovarian cancer, and also you should know what is the management for this type of ovarian cancers. Okay, this differentiation part and the management part. So these are the very important topics from the gynecology part. We'll move on to the obstetrics part. If you see this obstetrics part, you should know about this physiological changes in the pregnancy, especially the blood changes in the physiological changes in the pregnancy, and about this types of pelvis, okay, and which type of delivery is possible in this type of pelvis, and about this types of abortion. You should also study about this types of abortion even, and the recent MTP Act, okay, and about the recent MTP Act, there will be one short question in this. Fine, because it will be interlinked with PSM, obstetrics, and also the forensic medicine. Fine. And next one, it is the ectopic pregnancy. How will you diagnose this? What is the management you will do? And what are the complications can erupt from this ectopic pregnancy? So you should know these three components from the ectopic pregnancy, like diagnosis part, management, and its complication part. Fine. And about these two diseases, hypertension and diabetes, you should know how will you manage or which weeks you will deliver in a case of hypertension and diabetes. Fine, controlled one, uncontrolled one, which weeks you will deliver. So just learn about this management part, okay? And about this postpartum hemorrhage, you know the sequential management. So there will be a postpartum hemorrhage. First, what you will do, okay? What is the next step you will do? Like first, what you will give? You will start with oxytocin infusion. Then which step you will move ahead with? And finally, what you will do? You will try the suture techniques. If not, you will do angioembolization, and if not, finally, you will do the hysterectomy. So you should know the steps-wise management in a case of postpartum hemorrhage. Okay. And next about the abruptio placenta. In abruptio placenta, you should know what are the risk factors and how to diagnose, and about its management part. So three things: abruptio placenta, risk factors, diagnosis, and the management part. And same for the placenta previa. Mostly they will give this image and they will ask you which type of placenta previa is this. Fine. And their respective management. And next about the stages of labor. Like what are the stages of labor? They will give this thing and they will ask you which step does the female belongs to. Fine. And about this methods of breech extraction, they will give this image and they will ask you which of the following method is this. Fine. And about this episiotomy and perineal tear, mostly episiotomy they will give this image and there will be comparison between these two episiotomies. And about this perineal tear, mostly they will ask you about the management part or when you will do this management. Fine. And this topic, which is this normal puerperial changes, it is being getting highlighted nowadays. So they will ask you this. So uterus after 2 days, where does it lies? Okay, they will ask you this normal puerperial changes. And about the instruments, you should know about this forceps, retractors, visual inspection under acetic acid, pap smear instruments, and also the MVA syringes. So you should know to identify them in the examination. Okay. And in contraception part, now they mostly rely on the emergency contraception and about this long-term contraception methods. And if of the short terms, they try to ask about the complications or the side effects from the OCPs. Fine. Side effects and contraindications from the OCP part. So don't forget to study all these things. Fine. So that's all. That's about this obstetrics and gynecology most important topics. Fine. If you go through these topics, you will be able to get the maximum output of it, and you can get at least 30 questions from this important topics only. Okay. Next, we'll move on to our giant subjects, which is the medicine and surgery. In medicine, there will be approximately 30 questions will be there. So it will be always interlinked with pharmacology and pathology. Okay. We'll go system wise. In respiratory system, what is the important topics? If you see this asthma and COPD management part and their classifications. These are the two things you need to know for this respiratory system of asthma and COPD. Next, about this type of pneumonia and their management. Like how will you diagnose or how will you differentiate this pneumonia from X-ray? Like hematocyl formations in Staph aureus. Okay. So likewise, how will you able to differentiate these different types of pneumonia? Like community acquired pneumonia. Okay. And the in hospital acquired pneumonia. Fine. And about this ARDS type, they will ask you about this, which type of ARDS is this and how will you manage them. Fine. And about this pleural effusion, mostly what they will do, they will based on this criteria, they will ask you whether it is a transitive type of pleural effusion or an exudative type of pleural effusion. Fine. And the next topic, it is the most important one. They will ask from the pathology, pediatrics and medicine perspective. They will ask you about this pathophysiology of this cystic fibrosis and they will ask you to diagnose this. Fine. And this one, they ask from this anesthesia also. So they will ask you what is the type of respiratory failure. So they will give this classical history and they will ask you which type of respiratory failure can be seen in this patient. Okay. For example, if it is post-operative, you will think of type 3 respiratory failure. Okay. Next, CVS is the must-do topics from the medicine, and CVS, they will ask this JVP and ECG findings for sure. So JVP, what they will ask? They will ask about this A wave mostly, CV wave, X descent, Y descent, and their comparison in constrictive pericarditis and cardiac tamponade. Okay. The next one, it is what it is the ECG findings. So ECG findings, you should at least know for the WPW syndrome and also for the heart blocks. So these two ECGs, you must know them. Okay. So you should know this two ECG for sure. Whereas rest ECG, you may know or you may not know, and it is easy to interpret for also. Fine. And about cardiomyopathies, you should know about HOCM and dilated cardiomyopathy. And in MI part, which is the most important part from the cardiology, you should know about the diagnosis and the type of MI and what is the management you will do. Like if it is STEMI, non-STEMI, how will you proceed with the management part. Fine. And about these arrhythmias, you should know how to diagnose them or how they look in ECG, like AFib, ventricular tachycardia, PSVT and VFib. And what is the preventive methods and what is the management in a case of acute scenarios. So you should know this ECG findings and their proper management. Okay. And about the renal system, you should know this CKD staging, AKI types, mostly this differentiating between this pre-renal and renal type of AKI. Fine. And also about this nephrotic syndrome differentiation. How will you differentiate between this nephritic syndrome and nephrotic syndrome? How will you able to diagnose them? And if you diagnose them, what is the management you will do for them? Fine. And the next one, it is the type of renal tubular acidosis. What are the types of renal tubular acidosis? In which of the following findings you will see in type 1, type 2 and type 4. Okay. And about the rheumatology, you need to know about the SLE diagnosis and their management part. So we saw in pathology also. In diagnosis part will mostly rely on the antibodies. So you should know about this antibody part and what is the management you do, you should know. Fine. And the next part, it is the dermatomyositis. You should know about the clinical findings you will see in a case of dermatomyositis. Fine. Mostly the clinical features, the cotton papules, heliotropic rash. They will ask you with the image, the classical history. Fine. Next, from the CNS part of the medicine, you should know about the types of headache and their management, like the migraine and their management. Fine. And about these syndromes, Guillain-Barré syndrome, myasthenia gravis, multiple sclerosis, mostly on their diagnosis and how will you manage them. And this is the most important part for the both medicine and microbiology perspective. They will ask you about this types of meningitis based on their CSF findings, and this can also come in pediatric part. So 3 subjects included: pediatrics, microbiology and the medicine. So it is the must know topics. And you should also know about the spinal muscular atrophy. You should also know about the spinal muscular atrophy from the CNS. Fine. The final parts of GIT. GIT, you should know the small things like Mallory-Weiss tear and Boyer-Haave syndrome. You should know about how will you diagnose this celiac disease with the HPE examination, and you should also know about this ulcerative colitis and Crohn's disease. What is the management you do in a case of ulcerative colitis and Crohn's disease? You should know. Fine. And from the hepatobiliary system, you should know about this classification of this hepatitis based on the viral markers. So based on the viral markers, how will you classify this hepatitis? And Wilson's disease, how will you make this diagnosis? Are the clinical features like KF rings. And next one, it is the conjugated and unconjugated bilirubinemias. You should know this Dubin-Johnson syndrome, Rotor syndrome, you should remember. Fine. And about this liver cirrhosis, you should know about their complications and management of their complications. Fine. And you should finally know about the ascites and how will you identify or how will you differentiate this type of ascitic fluid. Fine. So in medicine part, the most important one, what are they? They are this respiratory system, CVS, and the final one, which is the endocrine. So you should know these 3 systems for sure before going to your examination. Fine. The third one, it is the endocrinology. So in endocrinology, you should know about the management of diabetes mellitus. You should know about the oral hypoglycemic drugs and the insulin part. And you should also know about the DKA drugs. Fine. And about the Graves' disease and its clinical features. Graves' disease features and what are the drugs you will use for hyperthyroidism. The same for Hashimoto thyroiditis. What are the drugs you will use for hypothyroidism. Fine. And you should know about the classification of these men's syndromes and causes of this hyperparathyroidism and the test which we use for this Conn syndrome and Addisonian crisis. They will give this classical history of this Addisonian crisis like low BP, low sugar, and they will ask you which of the following test you will use to determine the cause of this condition. So it is what? It is the Addisonian crisis. Fine. You will use this ACTH stimulation test. Okay. And you should also know about the clinical features seen in a case of Cushing syndrome. Fine. In a case of Cushing syndrome and what is the etiology for this Cushing syndrome. Fine. So these are the must know and most important topics from the medicine part. So if you know these things, you will be able to grasp the maximum number of questions. So you will be able to get at least 25 questions correct from the 30 questions. Fine. Next we see the surgery. In surgery, there are at least 30 to 35 questions they are being asked. And most of the surgical questions, they are clinical based. And in surgery, if you ask me, what are the few topics if you want to study for sure? They are what? They are the breast, GIT and thyroid. These are the 3 topics you should study for must. And if you get more optional, then you study the general surgery. Then see the rest topics. Fine. This is what my approach for surgery. So in surgery, there will be 30 to 35 questions will be asking. Okay. And if you read this most important topics, it will be around 40. So if you read this most important topics, you will be able to get the maximum questions from. Fine. And in breast, you need to know about this breast abscess and its management. You should know about this benign breast diseases like diagnosis of this fibroadenoma, duct papilloma and ductectasia. How will you diagnose these 3 conditions? And about this CA breast, you should know about this physical examination findings, and you should also know about this types of mastectomy and what are the complications can be occur after the mastectomy. Fine. And about this thyroid malignancies, you should know about the what are the types of thyroid malignancies and what are the types of thyroidectomy or what are the types of management we do for this thyroid malignancies. Fine. And next part, it is the complication after thyroidectomy. Like what are the complications? There might be hemorrhage can be happen, nerve paralysis, and how will you manage this? Fine. And about the hernia part, you should know how to differentiate between this indirect and direct hernia. So after differentiation, what you will do? You will do the management. So in management of the hernia, you should know these 2 topics, which is what? Which is the herniatomy, hernioplasty, and the mesh types. What are the types of mesh you will use for this hernioplasty, and what are the complications may arise after the hernia surgeries. Fine. Then we'll see about the trauma part of surgery. In surgery, the first trauma part you should focus on is what? It is the GCS scoring. You should focus on this Glasgow Coma Scale. And next, you should know about this blunt trauma abdomen from the surgery and the radiology perspective. You should do this E-FAST, and what is the next step of management after this E-FAST. If it is positive, negative, what you will do in the next step of management. Fine. Next, about this thoracic trauma, you should know few topics for sure. In thoracic trauma, you should know about the pneumothorax, hemothorax, cardiac tamponade, okay, and the flail chest. All of these conditions you should know how to diagnose or how they look in X-ray, and also you should know how will you able to manage these cases in emergency room. Fine. And about this brain hemorrhages, you should know how to differentiate between this EDH, SDH, subarachnoid hemorrhage and the intracranial hemorrhages. Fine. And about the shock, you also need to know about the differentiation of different types of shocks. They are the hypovolemic, neurogenic and the cardiogenic shock. Like how will you differentiate this different types of shock? This will be asked in your upcoming examination. Fine. And about this damage control surgery, and what is the protocol for the massive blood transfusion. So you should know these topics from the trauma perspective. Next, about the scores, you should know at least these scores before going to your examination, because they will ask this scores in alternative exams. So just remember about this course. And about this urinary stones we discussed in the pathology, we should know about the management in the surgical perspective. Fine. In the TB of the urinary system, you should also know what are the classical findings you will able to see from the urinary bladder, from the ureter. Fine. Next, about this testicular torsion, you should know what is the management of this testicular torsion. If testicular torsion happens, how will you differentiate between this acute epididymitis and how will you do the management part. Fine. And about the testicular torsion and its management. Okay, you should know about this testicular torsion and management, and you should know how you will able to differentiate this testicular torsion from this acute epididymoarthritis. Fine. And you should also know about this urinary bladder cancer management. Now recently they started asking about this management of this urinary bladder carcinoma. So just remember about this, how will you able to stage this urinary bladder cancer, and also how will you manage those cases. Fine. And about this foreigner gangrene, they have love with it. So they ask in most of examinations, and they will ask you what is the management you will do. Okay, and what is the layers are being affected and what is the causative organisms. So you should know about the causative organisms, layers, and what is the management you will do. Fine. And next, about the RCC, you should know where you will do this partial or total nephrectomy, and you should also know about the paraneoplastic syndromes which are being associated with RCC. So this is the first thing you should know about the RCC. You should know about the paraneoplastic syndromes. Fine. In surgery, I told the most important part, it is what? It is the GIT. So GIT you should know in and out. Like if possible, just read everything from GIT. Okay, because most questions of your GIT will be covered from surgery, and most questions will be coming from there only. Fine. In the first part, if you see, it is what? It is the achalasia cardia. They will ask you the diagnosis part and the management part. Fine. And the next one, it is what? It is the how will you able to differentiate it from this nutcracker's esophagus and the diffuse esophageal spasm. Fine. And about the CA esophagus, they will ask you about mostly about the management part. And in a case of infantile hypertrophic pyloric stenosis, they can give the image and they will ask you what is the diagnosis, or else they can ask you what is the electrolyte abnormality can be seen in this condition. Fine. And finally, about this peptic ulcer, they will ask about the complications from the surgery. So they will ask you what is the next step you will do if there is some kind of perforation or bleeding from the peptic ulcer. So you should remember about these complications, and you should also know about the types of gastrectomy surgeries. Fine. Types of gastrectomy surgeries. And when we move bit down, you will able to see this small bowel obstruction. So you should differentiate between this small bowel obstruction or the level of obstruction. They will give this barium image and they will ask you which of the following bowel is involved in this case. So you should be able to differentiate between these small bowels, and also you should be able to differentiate between this small bowel and a large bowel. Okay. And what are the bariatric surgery now we do, and how will you identify this duodenal atresia with double bubble sign. Fine. And you should also see with this intussusception, how will you identify or which of the following vaccine cause these side effects, or what are the barium signs you will be able to see in a case of intussusception. Fine. And in a case of valvulus, you should remember two valvulus. One is the sigmoid, another one is the cecal valvulus. Fine. And you should also know about the delayed passage of meconium, which is the Hirschsprung disease. Fine. And they may give you the image of ileostomy and colostomy. They will ask you what is the difference between them, or which of the following is this. They will give the image and they will ask you. So you should know how to differentiate between this ileostomy and colostomy. Fine. Next, you should know how to differentiate between this fistula in nano and fissure in nano. Fine. And also you should know about the cholecystectomy and also the types of choledocholithiasis. It is the choledocholithiasis. Okay. Remember, what are the types of choledocholithiasis and what are the types of choledochal cyst and what is the name of the classification we'll use for this choledochal cyst. And about the pancreatic part, you should know about the diagnosis of acute pancreatitis and what are the complications of this acute pancreatitis. Okay. And in a case of chronic pancreatitis, you should know about the X-ray and CT appearance, and you should also know about the risk factors of this chronic pancreatitis. Okay. And about the rest part, you should know about just the definitions or what are the classical features of this insuloma, gastrinoma and VAPoma. Fine. Next, from the general surgery perspective, you should know the types of sutures, what are the suture techniques you will do, and the types of knots like granny knots, reef knots, and the classification of burns. It is the most important point. And what are the rule you will use, and how will you calculate the fluids in a case of burns. Fine. And the same surgical instruments, types of grafts, and types of ulcers. Okay, types of ulcers. And finally, now they shifted their discussion or focus towards this parotid gland. They are asking more about this parotid glands. So if you see, they will ask about this parotid gland malignancy, and sometimes they will ask you about this cleft lip and cleft palate management. Okay, management of this cleft lip and cleft palate. Fine. And they also ask about the total parenteral nutrition. What are the indications of it, or what are the complications associated with the TPN. Okay. So these are the most important topics from the surgery perspective, and if you know these topics in and out, you can get all the questions correct from the surgery, which will range from 30 to 35. So you can get at least 30 questions from it. So guys, with the understanding, we'll move on to our next subject. Okay. Next, these are the short subjects, out of which mostly you will get 5 to 7 questions. Dermatology, psychiatry, anesthesia, orthopedics. You will get 5 to 7 questions, and if you read these topics, from these 5 to 7 questions, you will be able to at least answer 5 questions from each subject. Fine. First part, from dermatology. From dermatology, we'll see the important topics. The important topics in the dermatology are the alopecia areata and androgenic alopecia. How will you differentiate these two types of alopecia and what is the management you will do? Next, about this nail changes. What are the nail changes seen in a case of systemic diseases and other dermatological diseases? Like for example, what are the nail change you will see in a case of alopecia areata, lichen planus? They will ask this type of features. Like pterygium, they will ask for lichen planus. Pitting, they will ask for alopecia areata. So just remember. And about this finding, which is what? Which is the wood lamp examination findings. They will ask you which of the following condition you will see this coral reef wood lamp finding. Okay. So you should know which of the following condition will show this wood lamp finding of coral reef or coral red appearance. So it is what? It is the erythrasma. Fine. And you should also know to differentiate between the syphilis, LGV, chancroid, donovanosis. Okay. Their diagnosis and management using this STA kits and the normal drugs. Fine. And these few diseases you should know for sure. One of them is lichen planus. Next one is the psoriasis and acne. These 3 diseases you should know for sure in and out, like mostly the diagnosis part and the management part and their types. Fine. And next one is the contact dermatitis and contact leukoderma, like how they looks and what are the components responsible for this contact leukoderma. Fine. And you should know this topic for sure. It is the pemphigus vulgaris and bullous pemphigoid. These 2 topics you should know how to differentiate them by this direct immunofluorescence or by their bulla appearances. Fine. And about viral diseases, you should know about the HSV and HB infection, as I told from the microbiology also, and their management part. Fine. For scabies, you should know about how will you diagnose the scabies and what is the management you will do. The same for types of tinea and their management, and the same for leprosy, the types of leprosy, and how will you classify the leprosy, and what is the management you will provide for this multibacillary and paucibacillary leprosy. Fine. And the final point, it is the neurocutaneous syndromes. Okay, neurocutaneous syndrome, NF1, NF2, tuberous sclerosis, and Stewart-Weber syndrome. How will you able to differentiate this type of neurocutaneous diseases, and what are the classical findings you should know of. Fine. And about this tumors, you must know about this basal cell carcinoma. This basal cell carcinoma, it can be asked from ENT, dermatology, and also the surgical perspective. Fine. And you should also know what are the classification we use for melanoma, and also what is the histopathological findings in the case of squamous cell carcinoma. So these are the important topics from the dermatology point of view. Fine. Next, we'll move on to the psychiatry part. In psychiatry also, there will be 7 to 8 questions will be coming from this psychiatry. And if you read this module, you will be able to get at least 5 to 7 questions correct. And we know sometimes this psychiatry is being allied with pharmacology, which is the psychopharmacology, and the question number may increase up to 10. Okay, just remember the 10 questions can be asked from this small subject. Fine. And in psychiatry, you need to know just this few topics. What are they? They are this antipsychotic drugs and their side effects, drugs used in depression and their side effects. Okay. And schizophrenia, how will you able to differentiate, or what are the types of schizophrenia, what are the prognosis based on it, and what is the diagnostic criteria I will use. Fine. And about this special drug, that is the lithium, what are the uses of lithium, what are the dose, and about the next drug, which is the lithium. So from lithium you should know what are the use of lithium, what is the side effect, and what is the toxicity of the lithium. Fine. And this opioid alcohol we studied in forensic also, you should know what is the symptoms of their withdrawal and intoxication, what they produce us. Fine. And you should know about the classical description of this OCD. If it is diagnosed with OCD, how will you manage them? Fine. You should also know how to differentiate these eating disorders and what are the signs you will see, and also about the smoking cessation drugs. And finally, they are testing recently about this postpartum blues, depression, and psychosis. You should and you must know how will you able to differentiate these 3 conditions. Fine. And just see these 3 conditions: panic disorder, generalized anxiety disorder, and PTSD. They will ask one of the conditions in each exam. Fine. And about child psychiatry, you should know the stages and their fixation points. Okay. So these are the important topics from the psychiatry perspective. So you should get maximum number of questions from it, which is around 5 to 7, which will be most of the times from this topic only. Fine. We'll move on to the next subject, which is what? Which is the anesthesia. In anesthesia also the same 5 to 7 questions, and this 5 to 7 questions will be for sure from this must know and most important topics. If you see, what are they? This Mallam-Patti scoring and ASS scoring, one question will be there for sure. Next one is what? The instruments like ET tube, nasotracheal tube, okay, or nasopharyngeal airway tube, O2 delivery devices, and cannula. So at least 1 or 2 questions will be asked from these images. And the complication of spinal anesthesia and epidural anesthesia, these 3 anesthetics like inhalational anesthetics, their uses and side effects, intravenous anesthetics, their uses and side effects, and the side effects of local anesthetics. These are the very, very important points, and they are being repeatedly asked. Fine. And finally, the muscle relaxant, their classification and their reversal agent. So you should know this drugs for sure. And we know this, all of this, they will produce this complication, which is what? Which is the malignant hyperthermia, and we should know how to diagnose them and what is the management of this malignant hyperthermia. So these are the most important topics from the anesthesia, and if you know just these topics, you'll be able to get this 5 to 7 questions correct for sure. Next subject, it is the orthopedics. In orthopedics, there will be same 5 to 7 questions will be asked, and if you read these topics, you will get this 7 topics sometimes, but most of the times you will get this 5 questions for sure from these topics. Fine. What are the topics? You should know this benign and malignant lesions of the bone, and you should know how to differentiate one from other. Okay, that's it. Okay. You should know this classification of fracture, which is what? Which is this Salter and Harris classification. And you should also know the fractures of arm like supracondylar fracture, lateral condylar humerus fracture, and also you should know this other fractures, the special fractures like Colles fracture, Smith fractures, and Beren fracture. Okay, don't forget these fractures. And 2 dislocations, shoulder and hip joint, both anterior and posterior dislocation of shoulder and hip joint you should know. And finally, you should know about these joint disorders like rheumatoid arthritis, osteoarthritis and ankylosing spondylitis. You should know how to diagnose them and you should know how to differentiate one from each other. Fine. And finally, the last page of orthopedics, it is what? It is the gout and pseudo gout. How will you able to differentiate from the clinical picture and also from the X-ray findings? And in pediatric orthopedics, we should know these three diseases: developmental dysplasia, CTV and Perthes disease. And this can be asked from three subjects: radiology, pediatrics and orthopedics, scurvy and rickets. It is the must-do topic because they will give this X-ray findings and they will ask this clinical features from it even. So or else they will give this clinical features and they will ask you what is the diagnosis from it. So you should must do this scurvy and rickets for sure. And recently the trend is being changed towards this TB of vertebra and hip joint. So it is one of the valuable and most important part. Fine. Next one, I told from the anatomy also, you should know about the nerve injuries and what are the management you will do for this nerve injuries. Fine. And you should also know about the types of splints which will be used for this nerve injuries and what are the types of casts or instruments you will use in a case of orthopedics. Fine. And finally, it is our final part, it is the radiology. In radiology, there will be a maximum of 10 questions and out of these 10 questions, 5 to 6 questions, they are directly in relation with radiology, whereas 3 to 4 questions, they will be interlinked with anatomy, medicine and surgery or orthopedics even. So just remember, there will be around 10 questions from radiology. Okay, if you read these important topics, you can able to get around 6 to 7 from this topics only. Fine. What are the topics? The most important one, it is the effects of radiation and side effects of radiation. So what are the side effects of radiation? Next one, they were asking about this size of the lead apron. Fine. And this thing, it is the most important point from the radiology. It is what? It is the foreign body in the trachea and the esophagus. Fine. And you should know about this neuroradiological imaging. There will be disease with the spotters and also you should know to identify which of the following part from the brain it's. Fine. And from the abdominal part, you should know about how to diagnose this pneumoperitoneum, what are the X-ray findings, and from surgical perspective, you should know what is the next step in management. So whereas this pneumothorax mostly will diagnose from the surgical perspective only. Fine. And in prenatal ultrasound, you should know how does anencephaly looks like and how much is the anti-thickness, and you should also be able to diagnose this posterior valve and the intrauterine device. Okay. And finally, you should know about the radionuclide imaging. In radionuclide imaging, you should know what are the substances we use for the radionuclide imaging and the types of radiotherapy, hypo, fractionated radiotherapy, and these two scores, they are being very much popular, so they will be asked in future examinations. They are this BI-RADS and TI-RADS scoring. So these are the most important parts or most important points from the radiology part. If you know these important topics, you will be able to get at least 5 to 7 questions correct from this radiology part. So guys, that's it. These are the most important topics and the must know topics of this all 19 subjects. Just remember one thing, that time is now. So you should make use of this PDF or this video for sure. And if you able to make use of this video, you will able to get your pass mark and you will able to get maximum mark from your FMGE examination. Okay, I'm waiting to see you with the other side with colorful colors of passing the examination. Thank you for watching the video. Bye bye.